Good day everyone, I am MIKHAELA HUERTAS and together with me is KHARYLL IBANEZ, ALLISON JUNTELA, and MARX JUSTINIANI, and we will be presenting our research study entitled Emotional Intelligence Among Nursing Students. This study aimed to determine the emotional intelligence among nursing students. Specifically, it seeks to answer the following objectives. First, what is the demographic profile of nursing students when grouped according to age, sex, year level, academic performance, family income, and living status and arrangement. Second, what is the level of emotional intelligence among nursing students when taken as a whole and when grouped according to the following demographic profile. Third, is there a significant relationship between the overall level of emotional intelligence among nursing students and the following demographic profile: age, sex, year level, academic performance, family income, and living status and arrangement. And lastly, is there a significant difference in the overall level of emotional intelligence among nursing students when grouped according to the following profile variables: age, sex, year level, academic performance, family income, and living status and arrangement.
For research design, the descriptive quantitative research design was utilized, maximized through a survey method.
Participants of the study are levels 1, 2, 3, and 4 nursing students of University of St. LaSalle. Sample size of the study is 277 participants out of 907 total population. The study utilized a stratified random sampling with a 5% margin of error.
So for our instruments, we have used standardized questionnaire or EOSC. We have conducted it through face-to-face survey with the use of 5-point Likert scale. It is divided into two parts, demographic profile, and the second part is questions aligned to our objectives.
The results and discussion, Table 6 shows the demographic profile for a total of 277 participants. Results show that the majority of the participants are 21 years old and above, while the rest belong to under 21 years old and with a percentage of 46.2%. Furthermore, results display that there are more female participants with a total of 207 or 74.7% as compared to male participants with just a total of 70 or 25.3%. Then for the year levels, 4, 3, 2, and 1 students have a total of 82, 65, 57, and 73 participants respectively. Moreover, the majority of the participants got a very good GWA with a 61%, while 62 participants got excellent GWA, 22.4%, then 13% of participants got a good GWA, and the rest got a GWA of satisfactory and average. And lastly, the study participants came mostly from high-income backgrounds, 74.7% earning over 50,000 monthly. Then family structures were diverse with a majority living in nuclear families. In terms of living arrangements, most participants resided with their parents.
For as a whole, overall, participants have a high emotional intelligence with a mean of 3.78. For age, participants aged 21 and above with a mean of 3.79 had slightly higher emotional intelligence than younger participants, possibly due to more life experiences. For gender, male and female participants possesses high emotional intelligence. Therefore, regardless of gender, both can control their emotions. For year level, level 3 students had slightly higher emotional intelligence compared to other year levels, possibly due to the demanding nature of their courseworks. For GWA, students with a GWA average with a mean of 3.65 scored slightly higher than those with other GWAs. For monthly family income, those with one of the highest monthly family income of 30,001 to 40,000 with a mean of 3.69 had a slightly lower score of emotional intelligence compared to those in the 5,000 to 10,000 income range with a mean of 3.97. For type of family status, family type seems to have a small influence. Those in extended family with a mean of 3.80 scored slightly higher in emotional intelligence than those in nuclear families. Living status and arrangement. Living status seems to have a small influence. Those living alone with a mean of 3.85 scored slightly higher in emotional intelligence than those in living with parents, relatives, or friends.
There is a very weak significant relationship between the level of emotional intelligence and profile variable year level. Therefore, the null hypothesis is rejected at 0.05 level of significance. The result shows that year level is a factor in their level of emotional intelligence And the results suggest that as nursing students progress through their year level, their exposure to clinical settings and patient interactions positively influence the development of their emotional intelligence. However, there is no significant relationship between the level of emotional intelligence of the participants as a whole and profile variable age, monthly family income, sex, type of family status, GWA, and living status and arrangement. Therefore, the data failed to reject the null hypothesis at 0.05 level of significance. The results indicate that age, sex, GWA, monthly family income, and type of family status and living status are not indicators of their emotional intelligence.
Table 9 finding shows that emotional intelligence level among participants do not significantly vary based on factors like age, sex, year level, GWA, family status, or living arrangements. Statistical tests, including Mann-Whitney U and chi-square tests, did not reveal significant differences. However, there's a potential correlation between emotional intelligence and monthly family income.
For the conclusion, the majority of participants were female over 21 years old with high GPAs and lived with their parents in nuclear families. Overall, students exhibited high emotional intelligence regardless of age, sex, year level, family income, family type, or living situation. There was a weak positive correlation between emotional intelligence and year level, suggesting that emotional intelligence might increase with academic progression and challenging clinical experiences. No statistically significant relationships were found between emotional intelligence and other demographic factors, although family income showed a possible trend requiring further investigation.